What is trauma? Trauma, defined by Merriam-Webster, is a disordered psychic or behavioral state resulting from severe mental or emotional stress or physical injury. Simply put, trauma is a stress response to a perceived negative experience that has long-lasting negative emotional, behavioral, and physiological effects. Behavior associated with trauma is different from typical challenging behaviors, as they appear in response to a trauma and are not typical of a child in question. Common types of trauma that your child could experience may seem obvious. What one child may perceive as a threatening trauma-inducing situation, another child may not. The reaction a child has to a potentially traumatic situation depends on their individual personality, temperament, level of coping skills, proximity to the event, and whether or not they feel that they have a supportive family and a safe home environment. Some common types of trauma that a child may experience include physical, sexual, and emotional abuse, along with neglect. These might seem to some adults as common traumatic experiences. However, there are scenarios that many adults may not readily identify as being traumatic to a child, such as undergoing a surgery or medical procedure, moving, or even becoming momentarily lost from a parent at the grocery store. During a traumatic event, a child may experience their heart beating fast, heavy breathing, and sweating. They may even feel shaky, or, on the opposite spectrum, numb and immobile. The effects on the brain of a child that has experienced trauma, especially prolonged and repeated, such as abuse, can be serious. These effects are potentially lifelong and impact the brain both in its structure and overall function and development. The architecture of the brain may be altered, and the overall chemistry of the brain could be impacted too, such as the management of cortisol levels and adrenaline, both necessary in preparing one's body to react during a perceived threatening situation. As a result, children affected in this capacity could find it difficult to manage stress. They may constantly feel on alert, expecting there to be danger when there is none. Children may also develop mental health issues such as anxiety and depression. Other key areas of the brain responsible for learning and memory may also be forever damaged. At times, the symptoms of trauma in a child can easily be overlooked, as they may present as typical challenging behaviors. Examples include fighting in school, tantrums, daydreaming, and an overall inability to focus. However, there may be immediate and somewhat obvious reactions in a child that a trauma has occurred, such as crying, screaming, or even a vacant look on their face. Unfortunately, children do not always share with adults that they have experienced a traumatic event. Based on their age and/or cognitive level, they may lack the ability to vocalize, describe, or identify what was distressing. So how does a loving and supportive parent recognize the signs and symptoms of a trauma? Some signs and symptoms may be easily identified, such as a sudden change in personality, as in a child that was once outgoing is now somewhat withdrawn. A child may have difficulty eating, sleeping, and experience bedwetting. They may also reenact through play a situation that was upsetting. Children may also avoid places, situations, or people that they once were not apprehensive of. Your child could become clingy and fearful of your absence as well. However, if your child is able to vocalize their feelings, they may describe headaches, stomach aches, feelings of shame and guilt, being tired, or easily feel stressed. These could all be symptoms of stress and trauma. So how does a parent offer support or treatment if they find that their child has experienced trauma? Being open and able to listen without judgment is essential. Validating their feelings is also important. Children often pick up on adults' feelings and may edit their responses in a way that they feel is expected, or by trying to protect their parents' feelings. By remaining calm in your tone of voice and body language, a child may be more open to discussing their feelings and recover sooner. You will also lessen the possibility of your child feeling guilt, resulting in them shutting down further. Children may also benefit through play therapy, wherein they are able to work through their feelings associated with trauma in a safe and comfortable environment. Early detection of a trauma and an effective response are both important in lessening its negative long-term effects on a child's mind.